My wife in 4238. Can a doctor come check on her? She's really weak, and now her belly is hurting.
She had the baby a few hours ago. It sounds about right.
No. It's more than that. Now, she wasn't like this with our first child.
Was your first a C-section?
No, but...
It's normal. Trust me. She just needs some sleep.
I'm telling you, something's wrong. Now, if you can't come, can someone else?
Maternity.
This woman had just had a C-section, but Dr. Pravesh noticed she was passing blood in her urine. He immediately went to the gynecologist, asking for a recheck, but the doctor brushed it off, saying it was normal. Not long after, the woman started feeling intense abdominal pain. Her husband rushed to find a nurse and asked for a doctor's examination. The nurse insisted that post-surgery bleeding was normal. Even when the husband stressed the urgency, the nurse insisted the woman just needed rest. With no other choice, the husband called Dr. Pravesh. That's when he found out the nurse never checked on the patient. She claimed the hospital was understaffed, but Dr. Pravesh noticed that the other nurse was tending to a white patient just fine.
Why is it so difficult to look in on Miss Davies? I need to make sure that she gets proper care.
She's getting the same attention as everyone else.
Respectfully, it seems to me that she is not.
When they walked into the room, the woman was in so much pain, barely conscious. But the nurse kept insisting that it was just normal after surgery stuff. However, the urine bag was completely filled with blood, indicating that her condition was much more serious.
Tell me you are not that guy.
What are you implying?
It turned out that the attending doctor had been discriminating against patients. When the patient was white, he was attentive and thorough, but when the patient was black, he didn't even spare an extra minute. After Dr. Pravesh insisted, the doctor finally agreed to check on the woman after finishing his surgery.
You ordered the CT and labs. I need you to put a rush on it. A rush. Do you understand?
Yes.
But shockingly, over an hour later, the woman's test results still hadn't come back. The nurse kept saying the hospital was too busy, but the ER has clear emergency protocols. She hadn't even followed them. By this point, the woman's condition was getting much worse. Her body started shaking, and an ultrasound revealed she was bleeding heavily inside. They had to rush her to emergency surgery. Despite their best efforts, it was too late. She died because of all the time that had been wasted.
Would this have happened if Leo wasn't black?
This happens far too often to women of every color.
But it's 4 times more likely to happen to black women. That's a fact.
Even more shocking, the hospital director called it a failed emergency and ignored the doctor's discrimination to protect the hospital's reputation. All the husband got was an apology and a check for compensation.